Welcome back to Half More Babies. Today, we're diving into something lots of you have asked about. How do you actually find the best pediatrician for your kids?
hmm It's a really big decision, and we know it can feel overwhelming.
Totally. So our mission today is to kind of cut through the noise.
Exactly. We've looked at the info out there, and we want to pull out the key things you need to consider and some real steps you can
And
take.
make it actionable.
Right. There's just so much information floating around when you start looking.
Mm.
Websites, recommendations.
Yeah. So let's get straight to it. When you first start the search, what are the absolute must-haves to think about?
Okay. Well, the practical things are always a good place to begin. Location, location, location.
Right. Convenience matters.
It really does. Is the office actually easy for you to get to? We saw some example addresses like 1305 Hembry Road, Suite 203 in Roswell,
Okay.
and 1841 Piedmont Road, NE,
Mhm.
Suite 100 in Marietta. You need to think, okay, which one works with my commute, my daycare run, all that.
And not just where it is, but when they're open. Right. That about office hours.
Yeah, absolutely crucial. The info we have says standard hours are Monday to Friday, 11:00 a.m. to 9 p.m.
Oh, 9 p.m. That's pretty late.
It is, yeah. That could be a huge plus if you're working typical hours. And you definitely want to ask about after-hours care. What happens if your kid gets sick at 10 p.m.?
Good point. A must ask. And then, of course, there's the money side of things, insurance.
Always a big one. You need to know which insurance plans they accept. The list we saw was pretty broad. Aetna, CVS Health, Blue Cross Blue Shield of Georgia, Peach Care for Kids, United Healthcare, quite a few.
Okay.
But, and this is important, always, always call the office directly to confirm they take your specific plan.
Yeah. Don't just rely on the website list.
Exactly. Those lists aren't always perfectly up to date. A quick phone call can save you a lot of hassle, maybe even unexpected bills down the road.
Gotcha. Smart advice. And beyond just the normal Monday to Friday, what if something happens on a Saturday?
Definitely ask about weekend or holiday availability. Kids don't really schedule their illnesses conveniently, do they?
Ugh, no, they don't.
And another thing that's more common now is telemedicine. Ask if they do virtual visits.
Oh, right, like video calls.
Yeah. For some things, maybe minor issues or follow-ups, a quick virtual check-in can be incredibly helpful. Saves you a trip.
It's definitely a time saver. Okay, so that's the practical stuff. Now, sometimes parents wonder, pediatrician or family doctor, when is a pediatrician really the better choice?
Well, generally, if your child has any kind of special health situation, a pediatrician is usually the way to go.
Like what sort of situations?
Things like being born prematurely or having a birth defect or any ongoing sort of complex health concerns. Some kids just need that really focused expertise.
Okay.
Because family doctors, they're fantastic,
Yeah.
but they treat everyone, all ages. Pediatricians are specialists just for kids, from birth through adolescence.
So it's about that depth of focus. What's the actual difference in their training or experience?
Well, think about it this way. A family doctor might spend maybe, say, 10% of their time seeing kids.
Right.
A pediatrician, it's pretty much all they do.
Yeah.
Maybe 90% or more of their practice is focused solely on children's health.
Wow, that's a huge difference.
It means they see childhood illnesses and developmental stages much more frequently. They just have that deeper day in, day out experience with kids' specific needs.
Okay, that makes a lot of sense. So if you choose a pediatrician, what are the core services you should expect? What should they be offering?
A good pediatrician offers a whole range of things. You've got your essential well-child visits, for tracking growth and development.
Like the checkups.
Right. Physical exams, obviously. Immunizations and vaccines, super important.
Yep.
Then there's acute care for when they suddenly get sick.
Like fevers and ear infections.
Exactly. And also preventive care, trying to keep them healthy.
Mm.
Screenings,
Mm.
advice. And like we mentioned, access to essential after-hours care is key. You might also find they offer things like newborn circumcision, if that's relevant for you, or sports physicals for older kids.
So it's pretty comprehensive care, really, covering a lot of bases.
It should be, yeah.
Yeah.
They aim to be the main point of contact for your child's health.
But it's not just about the medical stuff, is it? What makes a pediatrician really great beyond just knowing the medicine?
Oh, absolutely. The
Yeah.
soft skills are huge. Great pediatricians are really good listeners. They actually hear your concerns.
That's so important.
And they need to be able to make kids feel comfortable, Doctor visits can be scary.
For sure.
A good one can also give advice on parenting stuff, family issues, because they understand that a child's health is tied to the whole family picture.
Seeing the bigger picture.
Yeah. And being non-judgmental, that's huge. Every family has its own way of doing things, different cultures, different parenting styles.
Right. They shouldn't make you feel bad about your choices.
Exactly. And obviously, extraordinary hygiene is just a baseline expectation.
Goes without saying.
And they should reinforce good behavior in kids, guide parents. Sometimes, having personal experience, maybe having their own kids or nieces and nephews, gives them that real-world understanding.
Yeah, they get it. They understand why you might be 5 minutes late because of a diaper explosion.
Right. Or why you really want to try and get all your kids seen in one go if possible.
Yeah,
That practical empathy matters.
definitely. Those are the things that build real trust. Okay, let's flip side for a second. Are there any potential downsides or challenges parents should be aware of?
Yeah, there are practical things. Cost is one, especially if you don't have insurance or you have a really high deductible plan.
Mm-hmm.
And like we said, insurance acceptance. Not every pediatrician takes every plan. It's
Right.
mentioned that, many in Atlanta take Medicaid, for example, some don't.
Yeah.
So you have to check that if it applies to you.
Crucial point about Medicaid. Okay, what else?
Some offices can be strict about missed appointments. You might even get sort of fired as a patient if you miss too many, especially that very first one.
Wow, really?
Yeah. So know their policy. And honestly, sometimes the office staff, their experience can vary. Ideally, everyone from the receptionist to the nurse is great with kids and understanding with parents, but
That's not always guaranteed.
it's not always guaranteed, no.
Right.
Where front desk experience can really color things.
Good point. Okay, let's circle back to kids with unique needs. Why is a pediatrician potentially even more critical in those cases?
Well, it really comes down to their specialized training.
Yeah.
Pediatricians get deep education in childhood conditions, congenital issues, developmental disorders, the whole spectrum.
Right.
And because they spend, like we said, maybe 90% of their time focused only on kids, they just see these things more often.
They recognize patterns faster, maybe?
Exactly. They build up this huge bank of experience in diagnosing and treating things that are common or even rare in childhood. Their expertise is just deeper in that specific area.
Okay. And what if other specialists are needed?
That's another key role. The pediatrician often acts as the coordinator.
Right.
If your child needs to see, say, a pediatric heart specialist or a neurologist, the pediatrician helps manage that overall care, making sure everyone's on the same page.
Like the quarterback for the child's health team.
Yeah, that's a good way to put it. They ensure the treatment plan makes sense for a child, specifically.
That must be incredibly reassuring for parents dealing with complex stuff. Now, what about online reviews? Everyone looks at reviews these days. How useful are they for picking a doctor?
They can be useful, definitely. Parental feedback gives you insights into the day-to-day experience,
Mm-hmm.
Searching for things like best pediatric clinic near me or top local pediatrician good reviews or 5-star pediatrician is a decent way to start building a list.
But you have to take them with a grain of salt.
Right, absolutely. You see mentioned sometimes about maybe high-quality doctors having certain expectations of families or maybe low-quality patients. Leaving reviews, you need context.
So how do you use reviews effectively?
Look for consistency. Don't just rely on one site. Check multiple review platforms, maybe even some less common ones. Are the same positive things being said over and over?
Okay.
Or are there recurring negative themes? That pattern across different sources is usually more telling than just one or two really glowing or really terrible reviews.
Look for the trend, not just the outliers.
Got it. So, for someone feeling a bit lost in all this, can we boil it down? What are the 3 main steps to actually finding a pediatrician?
Sure, it can be pretty straightforward. Step 1, research. Use your insurance website. Ask for recommendations from friends, family, maybe your OBGYN. Get a list of names in your area.
Yeah, research first.
Step 2, schedule introductory visits, sometimes called meet and greets. Pick 1 or 2 from your list and actually go meet them.
Talk to them face to face.
Yes, ask your questions, see the office, get a feel for their personality, see if it clicks.
And step 3.
Choose. Based on your research and those meet and greets, pick the one you feel most comfortable with, the one you trust most with your child's health. Research, meet, choose. Simple enough. And it's important to remember this isn't just about fixing ear infections now, is it? There's a longer view.
That's so true. A good pediatrician isn't just treating today's sniffles. They're thinking about your child's health long term, like into their teenage years and even young adulthood.
How does that show up?
They'll talk about things beyond the immediate issue. Nutrition, growth patterns, developmental milestones, maybe even future health risks based on family history. They're looking ahead.
Thinking about prevention and long-term well-being.
Exactly. You want someone focused on setting your child up for a healthy life, not just reacting to sickness.
That's a really important perspective. Okay, are there any other sort of official resources parents can look at for reliable info?
Well, absolutely. Two great ones are the American Academy of Pediatrics. Their website is aap.org.
AAP.org.
And the Centers for Disease Control and Prevention, the CDC. That's cdc.gov. Both have tons of trustworthy information for parents on all sorts of child health topics.
Excellent resources. This has been incredibly helpful, really breaking it down. Now, for listeners who want to dig even deeper, maybe find more specific resources for their search, where should they go?
Yeah, for more detailed information, specific guides, and resources tailored to finding the best pediatric care, a great place to visit is omegapediatrics.com.
Omegapediatrics.com. Got it.
They have a lot of useful content there to help parents through this process.
Perfect. So just to quickly recap the big takeaways, when you're looking for that pediatrician, think about location, hours, insurance. Consider any special needs your child might have. Look at the doctor's experience. Check out parent feedback, but look for patterns.
Right.
And remember that long-term health perspective. And for all the details and extra help, definitely check out omegapediatrics.com.
Well said. And hey, if you found this conversation useful today, we'd really appreciate it if you'd like this video.
Yeah, please do.
Subscribe to the channel so you don't miss our next deep dive. Maybe share this with another parent who's trying to figure this all out.